So the muscles of the head and jaw, there are three: the lateral and medial pterygoid and the masseter. Medial pterygoid is a muscle that is associated with the inner part of the jaw. So this portion of my muscle is called the medial pterygoid. Origin is the medial surface of the lateral pterygoid plate of sphenoid and maxilla and palatine bone. Insertion is the medial surface of the mandible near the angle. Portion of my muscle is called the lateral pterygoid. It is a small, thick, conical muscle that has backward direct tip. So for the origin is the greater wing and the lateral pterygoid of sphenoid plate. For the insertion is the condyle of mandible and the capsule of the temporomandibular joint. The muscle is called the masseter. It's a facial muscle that is located around the cheek. So the origin is the zygomatic arc and the maxilla, and the insertion is the angle and ramus of mandible. Portion of the muscle is called the serratus anterior. It's a thin muscular sheet of the thorax, arises from the first 8 or 9 ribs. So the origin of the serratus anterior is by the series of muscles lips from the 1 to 9 ribs. So the insertion of the serratus anterior is the anterior surface of the medial border of the scapula. For the subclavius, it is a small triangular muscle that depresses the shoulder. So for the origin, it's the costal cartilage of rib 1, and its insertion is the groove on the inferior surface of clavicle. So this portion of my muscle is called the sternocleidomastoid. It is one of the largest and most superficial cervical muscles. So the origin of the sternocleidomastoid is the mandibrium of the sternum, the medial portion of the clavicle. So the insertion of the sternocleidomastoid is the mastoid process of the temporal bone and the superior nuchal line of the occipital bone. The action of the sternocleidomastoid is the prime mover of the active head flexion when act together, rotates head toward opposite side when act singularly. Pectoralis minor is also located here. However, it is a deep muscle. So the pectoralis major is a muscle located under the pectoralis major, and both form an anterior wall of the maxilla. So the origin is the anterior surface of the ribs 3 to 5 and 2 to 4. So for the insertion is the coracoid process of the scapula. Okay, so the levator scapulae is a muscle that elevates the arm and moves it away from the levator scapula, and the origin of the levator scapula is the transverse process of C1 to C4. So the insertion of the levator scapula is the medial border of the scapula, which is this part, and it is the superior of the spine. Of the muscle is called the rhomboids, which has two parts, the rhomboid minor and the rhomboid major. So the blue part is the rhomboid minor, and the red part is the rhomboid major. So what is the rhomboid muscle? So talking about the origin of both muscles, for the rhomboid minor, it is the splenius process of C7 to T1. And for the rhomboid major, the origin is the splenius process of T2 to T5. And the insertion of both muscles is the medial border of the scapula here. This portion of the muscle is called the trapezius muscle, which is either of two flat triangular muscles. So talking about the origin of the trapezius muscle, which is its origin is the occipital bone and the ligamentum nuchae and the spines of C7 to T12, and the insertion of the trapezius muscle is the spine and the acromion scapula and the lateral third of clavicle. This movement is called the scapular elevation. The muscles involved here is the trapezius, which is the upper fibers, and the levator scapulae. Okay, so the second movement is called the scapular depression, which goes downward, and the muscles involved here are the serratus anterior lower fibers, the trapezius lower fibers, and the pectoralis major and the pectoralis. Okay, so the third movement is called the scapular adduction, which the movement goes inward, and the muscles involved here is the trapezius and the rhomboid major. Movement is called the scapular abduction, which goes outward, and the muscles involved here are the pectoralis major and the pectoralis minor. So the fifth muscle movement is called the scapular upward rotation, and the muscles involved here are the serratus anterior and the trapezius lower and upper fibers. The last muscle movement is called the scapular downward rotation. As he's going down, it returns to the anatomical position, and the muscles involved here are the levator scapulae, the rhomboid major, rhomboid minor, and lastly the pectoralis minor. Going to the part of the rotator cuff muscles, which are the supraspinatus, infraspinatus, and subscapularis, and the teres minor. Okay, so this portion of the muscle is called the supraspinatus. It is the smallest of the four rotator cuff muscles. Okay, so the origin of the supraspinatus muscle is the supraspinous fossa of scapula, and the insertion of the supraspinatus is the superior part of the tubercle of the humerus. So for the actions of the supraspinatus muscle, it helps to hold the head of the humerus. In the glenoid cavity, it stabilizes the shoulder joint and it rotates humerus laterally. Okay, so locating the infraspinatus muscle is below the scapular spine. So what is the infraspinatus muscle? It is a muscle that runs from the back of the surface of the shoulder blade to the back of the upper part of the arm bone. The origin of the infraspinatus muscle is the infraspinous fossa of scapula, and the insertion is the greater tubercle of the humerus and the posterior to supraspinatus. The location of the teres minor is in the lateral side of the scapula. So what is the teres minor? So the teres minor is a muscle that is a cylindric and elongated muscle of the shoulder. So the origin of the teres minor is the lateral border of the dorsal scapular surface, and the insertion is the greater tubercle of the humerus and inferior to the infraspinatus. For the subscapularis muscle, it can only be seen in the anterior part of the scapula. So what is the subscapularis? It is a large triangular muscle that fills up the subscapular fossa. So the origin of the subscapularis, it is the subscapular fossa of scapula, and the insertion of the subscapularis is the lesser tubercle of the humerus. The action of the subscapularis is it stabilizes the shoulder joint, and it also helps prevents downward dislocation of the humerus. So this portion of my muscle is the pectoralis major. The pectoralis major muscle is a thick fan-shaped muscle contributing to the thoracobrachial motion. The origins are the sternal end of the clavicle, the sternum, and the costal ribs 1 to 6, and the aponeurosis of the external oblique. Its insertion is by a short tendon of the intertubercular groove of the hus. Muscle is called the latissimus dorsi, which is known for its widest muscle in the human body, and it is also known as the broadest muscle of the back. Okay, so the origin of the latissimus dorsi is through the lumbodorsal fascia, and into the spine of T7 and L5 and the four ribs and the iliac crest. Okay, so talking about the insertion of the latissimus dorsi is the floor of the intertubercle groove of humerus. This portion of my muscle is called the deltoid muscle. It is a large triangular muscle and which lies over the glenohumeral joint, which gives the deltoid a round contour. The origin of the deltoid is the lateral third of clavicle and the acromion and the spine of the scapula. So for the insertion of the deltoid muscle, it is the deltoid tuberosity of the humerus. So this portion of my muscle is called the branchialis muscle, which lies in front of the elbow and my triceps branchi and behind of the anconeus muscle. So the origin is the front distal of the humerus. Muscle is the coronoid process of the ulna. Action for the branchialis is the major forearm flexor and it is the synergist with biceps branchi. Radialis, which is a forearm muscles that helps the forearm moves in different directions. The origin of the brachioradialis is the lateral supercondyle ridge at the distal end of the humerus. So the insertion of the brachioradialis is the base of the stylo process of the radius. So it's here. This portion of my muscle is called the biceps branchi. The biceps branchi is a two-headed muscle which lies on the upper arm between the shoulders and the elbow. So talking about the origin of the biceps branchi, the origin of the long head is the tubercle above the glenoid cavity and a lip of the glenoid cavity of the scapula. For the origin of the short head of the biceps branchi is the coronoid process of the scapula. So for the insertion of the biceps branchi is by the common tendon to radial tuberosity. The action for the biceps branchi is it flexes elbow joint and supinates forearm usually at the same time, and lastly weak flexor arm at shoulder. So the triceps branchi is a muscle. It is a large muscle that extends the entire length of the posterior surface of the humerus. Origin of the triceps branchi, which has three parts: the long head, the lateral head, and the medial head. So the origin for the lateral head, it is the posterior shaft of the humerus, and the long head, it is the infraglenoid tubercle of the scapula, and the medial head, it is the posterior humeral distal or shaft distal to radial. So let's talk about the insertion of the triceps branchi, which is by common tendon into olecranon process of ulna. The action of the triceps branchi is the agonist of the forearm extension, specifically the medial head, and it is the antagonist of the forearm flexors, and it also stabilizes the shoulder joints and assists to arm adduction, specifically the long head tendon. So this portion of the muscle is called the anconeus muscle. It is a small triangular extensor muscle that is superficially situated behind and below the elbow and that extends the forearm. Going to the origin of the anconeus muscle, it is the lateral epicondyle of the humerus And the insertion is the lateral aspect of the olecranon process. So this portion of my muscle is called the pronator teres. It is a thin, long muscle located on the underside of the forearm. For the origin of the pronator teres are the medial epicondyle of the humerus and the coronoid process of the ulna. So the insertion of the pronator teres is by a common tendon into the lateral radius and midshaft. Action for the pronator teres, it pronates forearm and weak flexor of elbow. This muscle is called the pronator quadratus. It is a rectangular muscle on the anterior forearm that connects between the radius and ulna. The insertion is into the lower one-fourth of the anterior surface of the shaft of the radius. The insertion is into the lower one-fourth of the anterior surface of the shaft of the radius. The action for the pronator quadratus are the pronation of the forearm of the radio-ulnar joints, forcibly supinates forearm with biceps branchi, and weakly supinates forearm working along, and lastly, the antagonist of the pronator teres. So this portion of my muscle is called the supinator. It is a broadened muscle in the posterior compartment of the forearm, curved around the upper third of the origin of the supinator is the lateral epicondyle of the humerus, the radial collateral, the annular ligaments, the supinator fossa, and the crest. The insertion are the lateral, anterior, posterior surfaces of the proximal one-third of the radius. So this portion of the muscle is called the semispinalis capitis. It is a deep longitudinal muscle of the back that arises from the transverse process of the upper 6th or 7th thoracic. And the origin of the semispinalis capitis, it is the transverse process of the C7 and to the T12. And the insertion is the occipital bone. So this portion of the muscle is called the spinous capitis. It is a flat muscle on each side of the back of the neck. And the origin of the spinous capitis is the spinous process of C7 to T6 and the ligamentum nuchae. And the insertion of the spinous capitis is the mastoid process of the temporal bone and the occipital bone. This portion of the muscle is called the serratus posterior inferior. So the serratus posterior inferior is a thin quadrilateral muscle at the junction of the thoracic region. So the origin of the serratus posterior inferior is the spinous process of the T11 to L2 and L3, corresponding to the supraspinatus ligament, blending with the lumbar part, the thoracolumbar fascia. Insertion of the serratus posterior inferior is the inferior borders and outer surfaces of the lower four ribs, specifically the 9th and the 12th rib, and the lateral to their angles. I'm going to mark where the scalene anterior is. This is the scalene anterior. So it is a muscle or one of the lateral muscles of the neck, and its origin is the anterior tubercle of the transverse process of C3 to C6. And its insertion is the scalene tubercle on the superior aspect of the first rib. So I'm going to mark the scalene posterior, which is the green part. The scalene posterior is known to be the smallest of the scalene muscles in the neck, and the origin of the scalene posterior is the posterior tubercles of the transverse process C4 to C6, and insertion is the postlateral surface of the second rib. So I'm going to mark the scalene middle, which is known as the blue marking. The scalene middle is known as the largest and the longest of the scalene muscles, and the origin of it is the posterior tubercles of the transverse process of C2 to C7. And the insertion of it is the superior aspect of the neck of first rib. Is the posterior side of the sternocleidomastoid, located at the base of the skull on either side of the neck behind the ears. So this portion of the muscle and its origin is the mandibuum of sternum and the middle portion of the clavicle, which is this part. So the insertion of the sternocleidomastoid is the mastoid process of the temporal bone, nuchal line of the occipital bone. The action of the sternocleidomastoid is the prime mover of the active head flexion when act together and rotates head toward opposite side when act singularly. This portion of the muscle is called the quadratus lumborum. It is the muscle of the posterior abdominal, and it is also known as the deepest abdominal muscle. The origin of the quadratus lumborum is the iliac crest, the lumbar fascia. So the insertion of the quadratus lumborum is the transverse process of the upper lumbar vertebra and the lower margin of the 12th rib. The quadratus lumborum, it flexes vertebral column laterally when together, it extends lumbar spine and fixes the 12th rib. Also, it maintains the upright posture, and lastly, it assists in forced breathing. So this portion of my muscle is called the rectus abdominis. That's where the six packs are located. The origin of the rectus abdominis is the pubic crest symphysis. For the insertion is the siphon process and the costal cartilage of the rib 5 to 7. The action for the rectus abdominis, it flex and rotate lumbar region of the vertebral column, and it fix and depress and stabilize pelvis during walking, and it increase intra-abdominal pressure. Transversus abdominis, it is a very deep postural muscle that influences the core strength and back health. Origins are the inguinal ligament, lumbar fascia, cartilage of last 6 ribs, and the iliac crest. Are the linea alba and the pubic crest. The action of the transverse abdominis, it compresses abdominal contents. Portion of my muscle is called the internal oblique. It is a muscle in the abdominal wall which lies below the external oblique and just above the transverse abdominal muscle, ligament, lumbar fascia, and the iliac crest. Insertion is the linea alba, pubic crest, last 3 or 4 ribs, and the costal margin. This portion of my muscle is called the external oblique. It is the outermost abdominal muscles extending from the lower half of the rib around and down to the pelvis. Origin is the outer surface of the lower 8th rib, and the insertion is the linea alba via aponeurosis. Together, synergies to rectus abdominis, vertebral column, and compressed abdominal wall. And when alone, synergies to muscles of back rotate and lateral flexion of trunk. So for the anatomy of the gluteal region, there are 3 superficial muscles, which are the gluteal maximus, gluteal medius, gluteal minimus. So for the gluteus maximus, its origin is the dorsal ilium, sacrum, and the coccyx. So here is the gluteus maximus. Its insertion is the gluteal tuberosity of the femur and the iliotibial tract. The action of the sternocleidomastoid is the prime mover of the active head flexion when act together and rotates head toward opposite side when act singularly.